If you or a loved one is experiencing chronic stress and anxiety and are concerned about the impact of heart disease or stroke, I would highly encourage you to listen in for the next few minutes as I'm going to share with you some insights that can powerfully impact how you go about your health care. Hi, I'm Dr. Mancini, the Medical Director of the Center for Integrative Care, a functional medicine and peak performance center here in San Diego. Research has shown that people who experience heightened levels of stress and anxiety are 4 to 5 times more likely to have a fatal heart attack or stroke. Now, before you get more anxious because you think you can't control your outside circumstances, I got some news for you. You're right, you can't. But there is something you can change, that you have complete control over. Now, before I share with you what you can do, let me first provide you how stress impacts heart disease and stroke, so you can increase your reasons and motivation for taking action now. See, a critical point to realize is when you get stressed, you increase what are called platelets in your body. Now, why in the world would the body produce more platelets? Well, what are platelets? Platelets are clotting factors. They clot. They create sludge in the body. So why would the body do that under stress? Here, I want to provide you with a fundamental point about stress, and here it is. Your body believes your brain as if whatever's being imagined or perceived is real. In other words, whatever you're thinking about with high emotional intensity, the brain believes it's really happening in that moment. Now, if your body chronically perceives your boss, work deadlines, and traffic as real threats, such as a tiger nearby, clotting factors will increase, preparing for a possible bite or claw from that imaginary tiger. Now, short-term stress, a brief increase of clotting factors is not the problem. It's the ongoing chronic stress of that perceived tiger, i.e. your boss, rush hour, or chronic fighting with a spouse that continues to fuel platelet production. So think about this. If you have a high amount of platelets, sludge, going through your heart, what can happen? Heart attack. And what if it goes to the brain? That's right, stroke. And then we often hear this, but I thought he was healthy. He was so stressed, he was type A, but you got a clean bill of health. I really did think he was healthy. Have you ever heard this, or maybe even said it? Now, hold on a second. If you think that was bad, there's more. Under chronic stress, the body produces hormones such as cortisol and epinephrine that can, over time, damage the heart muscle. These hormones also scar blood vessel walls of the heart and brain. This leads to buildup of plaque and those platelets we mentioned earlier. These factors are major risk factors for heart attack and stroke. Yes, the cause may have been high platelets, cholesterol, or inflammation, but it is not the source. The source is chronic stress. See, in today's world, more than any other time in history, we are getting overloaded and bombarded with demands. And the problem is we are not offsetting these high amount of demands with recovery. And if you keep on pushing, what do you think is going to happen? You're going to overload the nervous system, which is basically the circuit panel of your body. See, it's no different than your home. Think about it. Your electrical panel in your home. If you turn on every single electrical appliance, full blast, everything cranked up, and you get an oversized heater and you plug it in, you crank it up full blast, what do you think is going to happen? That's right, you're going to blow a fuse. Now, as annoying as that is, you have to remember it's a protective system, right? Because if we didn't have that system, what could happen? That's right, a fire or an explosion. Now, we have a very similar system in our bodies. Now, we won't explode or catch on fire, but we will overload the nervous system and it causes it to go into self-protection the same. Now, it doesn't start with a big condition or a big disease, but what it does do to self-protect is it starts to shut down function. It starts to reduce function because there's a high amount of power and demand going in, a high amount of stress. Think about it. If you drive a high amount of power and demands, also known as stress, into the heart, what could happen? That's right, a heart attack. Now listen carefully. You have the ability to make a change. This change is about changing the way you go about your health care. In other words, shifting your focus from only treating disease, signs, and symptoms to begin treating the source. And the source is always, I repeat, always a breakdown in function. Now, in order to begin to support your body function, we must begin looking not only at diet, lifestyle, exercise, but more importantly, at changing your standard of health and the mindset behind it. Now, this mindset is not about changing the external factors of stress, but rather your ability to handle the stressors of life and how you process those experiences in your body. Now, this is not an easy task, but after seeing thousands of patients in my nearly 2 decades of clinical practice, I found that this plays a major role in breaking through these conditions. When you retrain your mind to this high standard of health, your health changes for the better. The standard and mindset is exactly what we use here at the center to help patients break through health conditions that most say are impossible. Utilizing Chinese medical principles that have evolved over 3,000 years, combined with 21st century technologies such as neurofeedback brain training, biomedically based acupuncture, as well as dietary, herbal, and nutritional therapy based on blood tests, hormone panels, and other diagnostic markers, you have the ability to use the best of all medicines. So, if you'd like to find out more about how we can support you in raising your standard of health and addressing specific health concerns in a safe and effective way, contact our office to schedule a free consultation with one of our functional medicine specialists where they can answer any questions you have to find out if and how we can help you with your healthcare needs. I'm Dr. Mario Mancini, and I wish you the best.